ओके हेलो एवरीवन। आज हम लोग कंजेनाइटल एड्रेनल हाइपरप्लेजिया पढ़ेंगे CH पीडियाट्रिक्स में। सो नेल्सन है ये 21st एडिशन 2020। आज हमारा डेट है 15th ऑफ अक्टूबर 2025। सो स्टार्ट करते हैं। Congenital adrenal hyperplasia CH is a family of autosomal recessive disorders of cortisol biosynthesis, normal adrenal steroidogenesis. Cortisol deficiency increases the secretion of corticotropin, that is ACTH, which in turn leads to adrenocortical hyperplasia and overproduction of intermediate metabolites. Depending on the enzymatic step that is deficient, there may be signs, symptoms, and laboratory findings of mineralocorticoid deficiency or excess, incomplete virilization, or precocious puberty in affected males, and virilization or sexual infantilism in case of affected females. तो ये है, this is a 6-year-old girl with congenital virilizing adrenal hyperplasia, and the height was 8.5, height age was 8.5 years, bone age was 13 years. So bone age is advanced. Notice the clitoral enlargement in the B and labial fusion. Okay, her 5-year-old brother was not considered to be abnormal by the parents. The height age was 8 years and the bone age was 12.5 years. Okay, so 3 virilized females with untreated congenital adrenal hyperplasia. All were erroneously assigned male sex at birth. लग भी रहा है. And each had a normal female sex chromosome complement. Infants A and B had the salt wasting form and received the diagnosis early in infancy. Okay, and infant C was referred at 1 year of age because of bilateral cryptorchidism. Okay, so this can sometimes look like hypospadias here. Okay, notice the completely penile urethra. Such complete masculinization in females with adrenal hyperplasia is rare. Most of the infants have the salt wasting form. Okay, so diagnosis and treatment of congenital adrenal hyperplasia. 21 hydroxylase deficiency classic form. इसमें glucocorticoid deficiency will be there, bindcorticoid deficiency, salt wasting crisis, ambiguous genitalia in case of females, and postnatal virilization in males and females. Okay, in case of glucocorticoid deficiency, there will be decrease in cortisol, increase in ACTH due to feedback. There will be increase in baseline ACTH and baseline stimulated. Then there will be so there will be increase in baseline as well as ACTH stimulated at 17 hydroxy progesterone levels. ट्रीटमेंट के लिए ग्लूकोcorticoid that is hydrocortisone दे देंगे. For mineralocorticoid deficiency there will be hyponatremia, hyperkalemia and increase in plasma renin. Okay, plasma renin because there will be low aldosterone. ठीक है, मतलब एल्डोस्टेरॉन कम रहेगा तो मे बी कुछ फीडबैक होगा. मिनरलोकॉर्टिकॉइड फ्लूडोकॉर्टिसोन रिप्लेसमेंट देना है, सोडियम क्लोराइड सप्लीमेंटेशन देना है. एम्बिगुअस जेनिटलिया में क्या होगा, सीरम एंड्रोजन्स बढ़े हुए रहेंगे, वैजिनोप्लास्टी फॉर ओके एंड क्लिटोरल रिसेशन, सप्रेशन विद ग्लूकोकॉर्टिकॉइड्स. ठीक है. Then 21 hydroxylase deficiency but non-classical form, may be asymptomatic, precocious adrenarche will be there, hirsutism, acne, menstrual irregularity and infertility. There will be increase in baseline and ACT stimulated 17 hydroxy progesterone levels as previous, and there will be increase in the serum androgens. पुराना जैसा ही है बट एसिम्टोमेटिक रह सकता है. ये इनमें सप्रेशन विद ग्लूकोकॉर्टिकॉइड्स करना है, इसमें कोई मिनरलोकॉर्टिकॉइड नहीं दिया है इन्होंने. Then comes 11 beta hydroxylase deficiency. इसमें ग्लूकोकॉर्टिकॉइड डिफिशिएंसी इज देयर, बट कोई मिनरलोकॉर्टिकॉइड नहीं दिख रहा है, ठीक है। एम्बिगुअस जेनेटेलिया इन फीमेल्स, पोस्ट नेटल वेलाइजेशन एज यूजुअल, एंड एसोसिएटेड विद हाइपरटेंशन। इसमें हाइपरटेंशन होगा, ओके। कॉर्टिसोल लो, हाई ACTH, इसमें इंक्रीज बेसलाइन ACTH स्टिमुलेटेड 11 डिऑक्सी कॉर्टिसोल एंड डिऑक्सी कॉर्टिस्टेरॉन। ओके, ये आपका ऊपर वाला मोस्ट कॉमन होता है ना, ठीक है। फिर है ग्लूकोकॉर्टिकॉइड हाइड्रोकॉर्टिसोन रिप्लेसमेंट करना है, और वेजिनल प्लास्टिक लेटर रिसेशन, सप्रेशन विद ग्लूकोकॉर्टिकॉइड्स, सप्रेशन विद ग्लूकोकॉर्टिकॉइड्स। इन ग्लूकोकॉर्टिकॉइड्स की वजह से भी हाइपरटेंशन आगे हो सकता है। इम्पॉर्टेंट है कि इसमें प्लाज्मा एड्रेनलिन कम रहेगा, हाइपरटेंशन है, और हाइपोकैलिमिया रहता है, ठीक है। देन कम्स 3-beta dehydrogenase डिफिशियंसी क्लासिक फॉर्म। ग्लूकोकॉर्टिकॉइड डिफिशियंसी होगा तो कॉर्टिसोल कम हो जाएगा, ACTH बढ़ जाएगा। देन ग्लूकोकॉर्टिकॉइड ट्रीटमेंट देना है हाइड्रोकॉर्टिसोन से, ठीक है। इसमें और क्या है, मिनरलोकॉर्टिकॉइड डिफिशियंसी भी है, अच्छा। इसमें सॉल्ट वेस्टिंग क्राइसिस हो जाएगा। देन hyponatremia, hyperkalemia, and then will be increase in the plasma renin. इसमें हमने क्या किया, मिनरलोकॉर्टिकॉइड फ्लूडोकॉर्टिसोन रिप्लेसमेंट दिया एंड सोडियम क्लोराइड सप्लीमेंटेशन। एम्बिगुअस जेनेटेलिया के लिए वही सेम चीज, सर्जिकल करेक्शन ऑफ जेनिटल, सेक्स हार्मोन रिप्लेसमेंट कॉन्सोनेंट विद सेक्स और रियरिंग, सेक्स ऑफ रियरिंग। फिर है प्रिकॉशियस एडनार्की और डिसऑर्डर्ड प्यूबर्टी रहेगा तो उसके लिए सप्रेशन विद ग्लूकोकॉर्टिकॉइड्स करना है। अच्छा चलो ठीक है, फिर और एक बार देख लेते हैं क्या होता है इसमें। More than 90% of the CH cases are caused by 21 hydroxylase deficiency. This enzyme hydroxylates progesterone and 17-dehydroxyprogesterone to yield 11 this respectively. These conversions are required for synthesis of aldosterone and cortisol respectively. Both hormones are deficient in the most severe form, salt wasting form of the disease. Slightly less severely affected patients are able to synthesize adequate amounts of aldosterone but have elevated levels of androgens of adrenal origin. क्या बोला है, slightly less severely affected patients are able to synthesize adequate amounts of aldosterone but have elevated levels of androgens of adrenal origin. Okay, this is termed as simple viralizing disease. Then these two forms are collectively termed as classic 21 hydroxylase deficiency. Patients with non-classic disease have relatively mildly elevated levels of androgens and may be asymptomatic or have signs of androgen excess at any time after birth. Clinical presentation is dependent in part on the genotype. Okay. फिर क्या बोला है, approximately 1 in 15 to 20,000 में होता है births in most populations. 70% affected infants have salt losing form, 30% have simple viralizing form of the disorder. CH is less common in African American. ठीक है, चलो अगला है जेनेटिक्स। ओके, एक क्या दिया है, closely adjacent to but on the opposite DNA strand from CYP21 is this gene which encodes a connective tissue protein. Rarely deletions extend into TNX. Such patients may have a continuous gene syndrome consisting of CAH and Ehlers-Danlos syndrome. Okay, continuous gene syndrome, deletions of CYP21 extend into TNX consisting of CAH and Ehlers-Danlos. Okay, फिर है पैथोजेनेसिस क्लिनिकल मैनिफेस्टेशंस। कहीं टेबल कुछ नहीं दे रखी है। फिर क्या है, एल्डोस्टेरॉन एंड कॉर्टिसोल डिफिशिएंसी, बिकॉज बोथ कॉर्टिसोल एंड एल्डोस्टेरॉन रिक्वायर 21 हाइड्रोक्सिलेशन फॉर द सिंथेसिस. बोथ हार्मोन्स आर deficient in the most severe salt wasting form of the disease. This form constitutes approximately 70% of the cases of classic 21 hydroxylase deficiency. The signs and symptoms of cortisol adrenaline deficiency, aldosterone deficiency, and pathophysiology underlying them are essentially those described. These include progressive weight loss, anorexia, vomiting, dehydration, weakness, hypotension, क्योंकि अच्छा सोडियम लॉस हो रहा है, हाइपोग्लाइसीमिया, कॉर्टिसोल नहीं है, हाइपोनेट्रीमिया क्योंकि सोडियम अब्जॉर्ब नहीं हो रहा है, एंड हाइपरकैलीमिया. ठीक है. These problems typically first develop in affected infants at approximately 10 to 14 days of age. Okay. फिर है without treatment shock, cardiac arrhythmias and death may occur within days or weeks. ठीक है. CH differs from other causes of primary adrenal insufficiency in that precursor steroids accumulate proximal to the blocked enzymatic conversion. Because cortisol is not synthesized efficiently, ACTH levels are high. सही है. Leading to hyperplasia of the adrenal cortex and levels of precursor steroids that may be 100 times normal. अच्छा है. फिर है in the case of 21 hydroxylase deficiency, these precursors include 17 hydroxyprogesterone and progesterone. Progesterone and perhaps other metabolites act as antagonists of the mineralocorticoid receptor, thus may exacerbate the effects of aldosterone deficiency in untreated patients. Okay. Progesterone and perhaps other metabolites act as antagonists of the mineralocorticoid receptor, thus may exacerbate the effects of aldosterone deficiency in untreated patients. It is not unusual for children with classical CAH to require hospitalization for intercurrent illnesses during childhood. This is most likely to occur in the first 2 years of life and to be precipitated by gastroenteritis, because such illnesses may cause fluid and electrolyte losses, and vomiting may interfere with medication dosing. Okay. Children requiring high dose fluorocortisone doses are most likely to be hospitalized, presumably because these patients have the greatest propensity to salt wasting. Children requiring high dose of fluorocortisone doses are most likely to be hospitalized, presumably because those patients have the greatest propensity to salt wasting. ठीक है. फिर उसके बाद क्या है, prenatal androgen excess. The most important problem caused by accumulation of steroid precursors is that the 17 hydroxy progesterone is shunted into the pathway for androgen biosynthesis, leading to high levels of androstenedione and that are converted outside the adrenal gland to testosterone. अच्छा. This problem begins in affected fetuses by 8 to 10 weeks of gestation and leads to abnormal genital development in females. सारी दिक्कत फीमेल्स में हो जाती है. फिर है द एक्सटर्नल जेनेटिलिया ऑफ मेल्स एंड फीमेल्स नॉर्मली अपीयर आइडेंटिकल अर्ली इन जेस्टेशन. अच्छा, इसमें फिर है affected females who are exposed in utero to high levels of androgens of adrenal origin have masculinized external genitalia. This is manifested by enlargement of clitoris and by partial or complete labial fusion. Okay, the vagina usually has a common opening with the urethra, that is urogenital sinus. The clitoris may be so enlarged that it resembles a penis because the urethra opens below this organ. Okay, some affected females क्या है, the clitoris may be so enlarged that it resembles a penis because the urethra opens below this organ. Some affected females may be mistakenly presumed to be males, हाँ देखा, with hypospadias and cryptorchidism. फिर है the severity of virilization is usually greatest in females with the salt losing form of 21 hydroxylase deficiency. The internal genital organs are normal. The internal genital organs are normal because affected females have normal ovaries and not testes, and thus do not secrete anti-Mullerian hormone. Okay. क्या बोला है कि द सिवियरिटी ऑफ विरलाइजेशन इज ग्रेटेस्ट इन फीमेल्स विद द सॉल्ट लूजिंग फॉर्म ऑफ 21 हाइड्रोक्सिलेज डिफिशिएंसी The internal genital organs are normal because affected females have normal ovaries and not testes, and thus do not secrete anti-Mullerian hormone. अच्छा, फिर है prenatal exposure of the brain to high levels of androgens may influence subsequent sexually dimorphic behaviors in affected females. Females may demonstrate aggressive play behavior, tend to be interested in masculine toys such as cars and trucks, and often show decreased interest in playing with dolls. Okay, women may have decreased interest in maternal roles. There is an increased frequency of homosexuality in affected females. Nonetheless, most function heterosexually and do not have gender identity confusion or dysphoria. Okay. It is unusual for affected females to assign themselves as a male role, except in some with the severest degree of virilization. Okay. ये अच्छा एक दिया है, बोला है it is unusual for affected females to assign themselves a male role except in some with the severest degree of virilization. More फिर क्या, male infants appear normal at birth. Thus the diagnosis may not be made in males until signs of adrenal insufficiency develop. Because these patients with this condition can detect quickly, infant males are more likely to die than infant females. Okay. For this reason, all 50 American states and many countries have newborn screening for this condition. सही बात है. फिर है postnatal androgen excess. Untreated or inadequately treated children of both sexes develop additional signs of androgen excess after birth. Males with a simple virilizing form of 21 hydroxylase deficiency often have a delayed diagnosis because they appear normal and rarely develop adrenal insufficiency. Signs of androgen excess include rapid somatic growth and accelerated skeletal maturation. Thus, affected patients are tall in childhood, but premature closure of the epiphysis causes growth to stop relatively early, and adult stature is stunted. सही बात है. Muscular development may be excessive. Pubic and axillary hair may appear, and acne and a deep voice may develop. The penis, scrotum, and prostate may become enlarged in affected males. However, the testes are usually prepubertal in size, so that they appear small relative to the enlarged penis. Achha. The penis, scrotum, and prostate may become enlarged in affected males. However, the testes are usually prepubertal in size, so that they appear small relative to the enlarged penis. ठीक है. Occasionally, ectopic adrenocortical cells in the testes of patients become hyperplastic, similarly to the adrenal glands. Producing occasionally ectopic adrenocortical cells in the testes of patients become hyperplastic, similarly to the adrenal glands, producing testicular adrenal test tumors. The clitoris may become further enlarged in affected females, although the internal genital structures are female. सही बात है. Breast development and menstruation may not occur unless the excessive production of androgens is suppressed by adequate treatment. Correct. अच्छा, फिर क्या है, similarly but usually milder signs of androgen excess may occur in non-classic 21 hydroxylase deficiency. Similar but usually milder forms of androgen excess makes it non-classical. ठीक है. In this attenuated form, cortisol and aldosterone levels are normal, and affected females have normal genitals at birth. अच्छा. Males and females may present with precocious puberty and early development of pubic and axillary hair. Hirsutism, acne, menstrual disorders, and infertility may develop later in life, but many females and males are completely asymptomatic. ठीक है, नॉन क्लासिक फॉर्म में. Adrenomedullary dysfunction. Development of the adrenal medulla requires exposure to the extremely high cortisol levels normally present within the adrenal gland. Thus, patients with classic CAH have abnormal adrenomedullary function, as evident by blunted epinephrine responses, decreased blood glucose, and lower heart rates with exercise. Sure. Ability to exercise is unimpaired, and the clinical significance of these findings is uncertain. Adrenomedullary dysfunction may exacerbate the cardiovascular effects of cortisol deficiency in untreated or undertreated patients. ये समझना पड़ेगा क्या है. अच्छा, लेबोरेटरी फाइंडिंग्स देखेंगे. पेशेंट्स विद सॉल्ट लूजिंग डिजीज हैव टिपिकल लेबोरेटरी फाइंडिंग्स एसोसिएटेड विद, या पेशेंट्स विद सॉल्ट लूजिंग डिजीज हैव टिपिकल, हाँ, with cortisol and aldosterone deficiency including hyponatremia, hyperkalemia, metabolic acidosis and often hypoglycemia. But these abnormalities can take 10 to 14 days or longer to develop after birth. Blood levels of 17-hydroxyprogesterone are markedly elevated. However, levels of this hormone are high during the first 2 to 3 days of life, even in uninfected infants, and especially if they are sick or premature. After infancy, once the circadian rhythm of cortisol is established, 17-hydroxyprogesterone levels vary in the same circadian rhythm. Yeah, after infancy, once the circadian rhythm of cortisol is established, 17-hydroxyprogesterone levels vary in the same circadian rhythm, being highest in the morning and lowest at night. ठीक है. Blood levels of cortisol are usually low in patients with the salt-losing type of disease. They are often normal in patients with simple viralizing disease and but inappropriately low in relation to the ACTH and 17-hydroxyprogesterone levels. Okay, ये अच्छी चीज लिखी है. फिर in addition to 17-hydroxyprogesterone, levels of androstenedione and testosterone are elevated in affected females. सही बात है. Testosterone is not elevated in affected males because normal infant males have high testosterone levels compared with those seen later in childhood. क्या बोला है? Testosterone is not elevated in affected males because normal infant males have high testosterone levels compared with those later in childhood. Okay. Whereas levels of urinary 17-ketosteroids and pregnenolone are elevated but are now rarely used clinically because blood samples are easier to obtain than 24-hour urine collections. Whereas ACTH levels are elevated, feedback की वजह से, but have no diagnostic utility over 17-hydroxyprogesterone levels. Plasma levels of renin are elevated and serum aldosterone level is inappropriately low for the renin level. However, renin levels are high in normal infants. High in normal infants in the first few weeks of life. Okay. फिर है diagnosis of 21-hydroxylase deficiency is most reliably established by measuring 17-hydroxyprogesterone before and 30 or 60 minutes after an IV bolus of 0.125 to 0.25 milligrams of ACTH. Okay. Nomograms exist that readily distinguish normals and patients with non-classical and classical 21-hydroxylase deficiency. Heterozygous carriers of this autosomal recessive disorder tend to have higher ACTH stimulated 17-hydroxy. Heterozygous carriers of this autosomal recessive disorder tend to have higher ACTH stimulated 17-hydroxyprogesterone levels than genetically unaffected individuals. But there is significant overlap between subjects in these two categories. क्या मतलब है? Nomograms exist that readily distinguish normals and patients with non-classic and classic 21-hydroxylase deficiency. Heterozygous carriers of this autosomal recessive disorder tend to have higher ACTH stimulated 17-hydroxylase levels. हाँ, क्योंकि ऑलरेडी एलिवेटेड थे, आपने दिया तो फिर और थोड़ा सा एलिवेट हो जाता होगा कुछ, than genetically unaffected individuals, but there is significant overlap between subjects in this story. However, in infants with frank electrolyte abnormalities or circulatory instability, it may not be possible or necessary to delay treatment to perform this test, as levels of precursors will be sufficiently elevated on a random blood sample to make the diagnosis. Okay. Genotyping is clinically available and may help to confirm the diagnosis, but it is expensive and may take weeks because the gene conversions that generate most mutant alleles that transfer more than one mutation At least one parent should also be genotyped to determine which mutations lie on each allele. Okay, ये नया है. At least one parent should also be genotyped to determine which mutations lie on each allele. फिर है डिफरेंशियल डायग्नोसिस. कितना बचा है? अच्छा, अभी तो ट्रीटमेंट भी बचा है. Differential diagnosis. Disorders of sexual development are discussed. The initial step in evaluating an infant with ambiguous genitalia is a thorough physical examination to define the anatomy of the genitals, locate the urethral meatus, palpate the scrotum or labia, and the inguinal regions for testes. Palpable gonads almost always indicate the presence of testicular tissue and thus that the infant is a genetic male. And look for any other anatomical abnormalities. फिर है अल्ट्रासोनोग्राफी इज यूजफुल इन डेमोन्स्ट्रेटिंग द प्रेजेंस और एब्सेंस ऑफ अ यूट्रस एंड कैन ऑफन लोकेट द गोनाड्स. A rapid karyotype used as such as fluorescence in situ hybridization of interphase nuclei for X and Y chromosomes can quickly determine the genetic sex of the infant. Rapid karyotype such as fluorescence in situ hybridization with the fish of interphase nuclei of X and Y chromosomes से पता चल जाएगा. Okay. Whereas these results are all likely to be available before the results of hormonal testing and together allow the clinical team to advise the parents as to the genetic sex of the infant and the anatomy of internal reproductive structures. Injection of contrast medium into the urogenital sinus of a virilized female demonstrates a vagina and uterus, and many surgeons use this information to formulate a plan for surgical management. ठीक है. फिर prenatal diagnosis. Prenatal diagnosis 21 hydroxylase is possible late in the first trimester by analysis of DNA obtained by CVS, okay, chorionic villus sampling, or during the second trimester by amniocentesis. Okay, this is usually done because the parents already have an affected child. Okay, yes. फिर है most often the CYP21 gene is analyzed for frequently occurring mutations. Most rare mutations may be detected by DNA sequencing. Newborn screening. Because 21 hydroxylase deficiency is often undiagnosed in affected males until they have severe adrenal insufficiency. All states in US and many other countries have instituted newborn screening programs. These programs analyze 17 hydroxyprogesterone levels in dried blood obtained by heel stick and absorbed on filter paper cards. The same cards are screened in parallel for other congenital abnormalities, conditions such as hypothyroidism and phenylketonuria. Potentially affected infants are typically quickly recalled for additional testing, that is electrolytes and repeat 17 hydroxyprogesterone determination at approximately 2 weeks of age. 2 weeks of age. फिर है infants with salt wasting disease often have abnormal electrolytes by this age but are usually not severely ill. Okay. Thus, screening programs are effective in preventing many cases of adrenal crisis in affected males. The non-classic form of the disease is not reliably detected by newborn screening, but this is of little clinical significance because adrenal insufficiency does not occur in this type of 21 hydroxylase deficiency. सही बात है. Whereas the main difficulty with current newborn screening programs is that to reliably detect all affected infants, the cutoff 17 hydroxyprogesterone levels for recalls are set so low that there is a very high frequency of false positive results. That is, the test has a low positive predictive value of as little as 1%. Oh. This problem is worst in premature infants. Positive predictive value may be improved by using cutoff levels based on gestational age and by using more specific second tier screening methods such as liquid chromatography followed by tandem mass, that is TMS. Okay. ये बोल रहा है दिस प्रॉब्लम इज वर्स्ट इन प्रीमेच्योर इन्फेंट्स. देन आपका जेस्टेशनल एज से करना चाहिए and by using more second tier screening methods. ठीक है. Low positive predictive value of as little as 1%. Treatment: glucocorticoid replacement. Cortisol deficiency is treated with glucocorticoids. Treatment also suppresses excessive production of androgens by the adrenal excessive production Treatment also suppresses excessive production of androgens by the adrenal cortex and thus minimizes problems such as excessive growth and skeletal maturation and virilization. ठीक है. फिर this often requires large glucocorticoid doses than are needed in other forms of adrenal insufficiency. Typically 15 to 20 milligram per meter square per day of hydrocortisone daily, administered orally in 3 divided doses. Affected infants usually require dosing at the high end of this range. Okay. Where double or triple doses are indicated during periods of stress such as infection or surgery. Glucocorticoid treatment must be continued. Glucocorticoid treatment must be continued indefinitely in all patients with classic 21 hydroxylase deficiency but may not be necessary in patients with non-classic disease unless signs of adrenal excess are present. Therapy may be individualized. It is desirable to maintain linear growth along percentile lines. Crossing to higher height percentiles may suggest under treatment, whereas loss of height percentiles often indicates over treatment. Whereas loss of height percentiles. Therapy must be individualized. It is desirable to maintain linear growth along percentile lines. Crossing to higher height percentiles may suggest under treatment. सही बात है. Whereas loss of height percentiles may indicate over treatment with glucocorticoids. Over treatment is also suggested by excessive weight gain. Okay, glucocorticoids की वजह से. हाँ ठीक है. Pubertal development should be monitored by periodic examination and skeletal maturation is evaluated by serial radiographs of the hand and wrist for bone age. Hormonal levels, particularly 17-hydroxyprogesterone and androstenedione, should be measured early in the morning before taking the morning medications or at a consistent time in relation to medication dosing. Okay. In general, desirable 17-hydroxyprogesterone levels are in the higher normal range or several times normal. Low normal levels can usually be achieved only with excessive glucocorticoid doses. Alternative delivery modalities have undergone small clinical trials, including delayed release hydrocortisone tablets and the use of a continuous subcutaneous insulin infusion device, insulin pump, to deliver hydrocortisone in a pattern more closely approximating the normal diurnal variation in cortisol secretion. ठीक है. At present, these approaches have not entered clinical practice. Where menarche occurs at the appropriate age in most females in whom good control has been achieved. It may be delayed in females with suboptimal control. Children with simple virilizing disease, particularly males, are frequently not diagnosed until 3 to 7 years of age, at which time skeletal maturation may be 5 years or more in advance of chronological age. सही बात है. In some children, especially if the bone age is 12 years or more, spontaneous central puberty, that is gonadotropin dependent puberty, may occur when treatment is instituted, because therapy with hydrocortisone suppresses production of adrenal androgens and thus stimulates the release of pituitary gonadotropins if the appropriate level of hypothalamic maturation is present. ये बड़ा बढ़िया लिखा है. In some children, especially if the bone age is 12 years or more, spontaneous central puberty may occur when the treatment is instituted, because therapy with hydrocortisone suppresses the production of adrenal androgens, ठीक है, and thus stimulates the release of pituitary gonadotropins if the appropriate level of hypothalamic maturation is present. This form of superimposed true precocious puberty may be treated with a gonadotropin hormone releasing hormone GnRH along such as leuprolide. ठीक है. फिर है इसको कैसे पढ़ना पड़ेगा. Males with 21 hydroxylase deficiency who have had inadequate corticosteroid therapy may develop testicular adrenal rest tumors, which usually regress with increased steroid dosage. Testicular MRI, ultrasonography, and color flow Doppler examinations help to define the character and extent of disease. Testis-sparing surgery for steroid unresponsive tumors has been reported. Testis sparing surgery for steroid unresponsive tumors has been reported. Males with 21 hydroxylase deficiency who have had inadequate corticosteroid therapy may develop testicular adenoid tumors, which usually regress with increased steroid dosage. ठीक है. Mineralocorticoid replacement. Patients with salt wasting disease, that is aldosterone deficiency, require mineralocorticoid replacement with photocortisone. Infants may have very high mineralocorticoid requirements in the first few months of life, usually 0.1 to 0.3 milligram daily in 2 divided doses, but occasionally up to 0.4 milligram daily, and often require sodium supplementation, that is sodium chloride 8 millimoles per kg in addition to the mineralocorticoid. Older infants and children are usually maintained with 0.05 to 0.1 milligram daily of fluorocortisone. In small patients with simple viralizing disease may be easier to control with a low dose of fluorocortisone in addition to hydrocortisone, even when these patients have normal aldosterone levels in the absence of mineralocorticoid replacement. फिर से पढ़ेंगे. In some patients, simple viralizing disease may be easier to control with a low dose of fluorocortisone in addition to hydrocortisone, even when these patients have normal aldosterone levels in the absence of mineralocorticoid. The therapy is evaluated by monitoring of vital signs. Tachycardia and hypertension are signs of overtreatment with mineralocorticoids. Serum electrolytes should be measured frequently. Yes, serum electrolytes should be measured frequently in early infancy as therapy is adjusted. Plasma renin activity is a useful way to determine the adequacy of therapy. It should be maintained in or near the normal range but not suppressed. Okay. Serum electrolytes monitor करना है. Plasma renin activity is a useful way to monitor the adequacy of therapy. ठीक है. फिर क्या बोला है? Additional approaches to improve outcome have been proposed but have not yet become the standard of care. These include an anti-androgen such as flutamide to block the effects of excessive androgen levels, and or aromatase inhibitor such as anastrozole, which blocks the conversion of androgens to estrogen and thus retards skeletal maturation, a process that is sensitive to estrogens in both males and females. Aromatase inhibitors generally should not be used in pubertal females because they will retard normal puberty and may expose the ovaries to excessive levels of gonadotropins. Growth hormone with or without LH releasing hormone agonist to retard skeletal maturation has been suggested to improve adult height. ये भी आपका एंडोक्राइन है, थोड़ा पढ़ना पड़ेगा. फिर है सर्जिकल मैनेजमेंट ऑफ एम्बिगुअस जेनाइटल्स. Significantly viralized females usually undergo surgery between 2 and 6 months of age. If there is severe clitoromegaly, clitoris is reduced in size with partial excision of the corporal bodies and preservation of the neurovascular bundle. However, moderate clitoromegaly may become less noticeable even without surgery as the patient grows. Vaginoplasty and correction of the urogenital sinus are performed at the time of clitoral surgery. Revision in adolescence is often necessary. Revision in adolescence is often necessary. Okay. Whereas risks and benefits of surgery should be fully discussed with parents affected females. There is limited long-term follow-up of functional outcomes in patients who have undergone modern surgical procedures. It appears that female sexual dysfunction increases in frequency and severity in those with the most significant degrees of genital virilization. It appears that female sexual dysfunction increases in frequency and severity in those with the most significant degrees of genital virilization and with the degree of enzymatic impairment, prenatal androgen exposure caused by each patient's mutations. Okay. Whereas 6 assignment of infants with disorders of sexual differentiation, including CH, is usually based on expected sexual functioning and fertility in adulthood with early surgical correction of the external genitalia to conform with the 6 assignment. Gender dysphoria is not common with CH. It occurs mostly in females with the salt wasting form of the disease and the greatest degree of virilization. Okay. फिर है lay and medical opponents of genital surgery for those क्या lay and medical opponents of genital surgery for other disorders of sexual differentiation break up the concern that it ignores any prenatally biased gender role predisposition from androgen exposure and precludes the patient from having any decision as to the patient's own preferred sexual identity and what surgical correction of the genitals should be performed. They advocate that treatment should be aimed primarily at educating the patient, family, and others about the medical condition, its treatment, and how to deal with the intersex condition. They propose that surgery should be delayed until the patient decides on what, if any, correction should be performed. Not all lay groups support delayed surgery, and many agree with appropriate surgery during infancy. Severely क्या है severely virilized genotype that is XX females raised as males have generally functioned well in the male gender as adults. In adolescent and adult females with poorly controlled 21 hydroxylase deficiency, that is hirsutism, obesity, amenorrhea, bilateral laparoscopic adrenectomy may be an alternative to standard medical hormone replacement therapy. अच्छा with hormone replacement, okay. But because the adrenal glands have been removed, patient treated in this way may be more susceptible to acute adrenal insufficiency if the treatment is interrupted. सही बात है. फिर moreover, they may exhibit signs of elevated ACTH levels such as abnormal pigmentation. Moreover, they may exhibit signs of elevated ACTH levels such as abnormal pigmentation. Okay. So towards the end है prenatal treatment. Besides genetic counseling, the main goal of prenatal diagnosis is to facilitate the prenatal treatment of affected females. Mothers with pregnancies at risk may be given dexamethasone, a steroid that readily crosses the placenta, in an amount of 20 microgram per kg pre-pregnancy maternal weight daily in 2 to 3 devices doses. Okay, this suppresses the secretion of steroids. This suppresses the secretion of steroids by the fetal adrenal, including secretion of adrenal androgens. If started by 6 weeks of gestation, it ameliorates virilization of the external genitalia in affected females. फिर क्या है को CVS coronary biopsy अच्छा is then performed to determine the sex and genotype of the fetus. Therapy is continued only if the fetus is an affected female. DNA analysis of fetal cells is isolated from maternal plasma for sex determination, and CAP21 gene analysis may permit early identification of the affected female fetus. फिर है treatment should be considered only in affected female fetuses. Children exposed to this therapy have slightly lower birth weights. Okay, effects on personality or cognition such as increased shyness have been suggested that but not consistently observed. At present, there is insufficient information to determine whether the long-term risks are acceptable, particularly in the males and unaffected females who derive no direct benefit from the treatment. Maternal side effects of prenatal treatment. क्या maternal side effects of prenatal treatment have included edema, excessive weight gain, hypertension, glucose intolerance, Cushingoid facial features, and severe striae. Consensus statements from professional societies recommend that prenatal treatment be carried out only under institutional protocols, but it is sometimes offered as an option outside the research setting by high-risk obstetricians in some locales. Okay. Thank you.